Hi, welcome to the Leche League of Lehigh County, September 14th, Wednesday evening meeting. Tonight's topic is common misconceptions. Because of the start of school and some illnesses, I am the only leader here tonight. My name is Alyssa Mayerta. I'm also a member of the Lehigh Valley Breastfeeding Coalition, and I'm here to answer questions and talk about common misconceptions about breastfeeding. In the background, you may hear my youngest, Jethro, making some noise, and if I disappear for a moment, I'm taking care of him. Leche League International was founded in 1956 by a group of 7 women at a church picnic. It was at a time when formula was the new scientific way to feed your baby. So there really wasn't much support for breastfeeding, and these 7 women got together and said they wanted to have more support for breastfeeding their children. So they started meeting in living rooms, and now 60 years later, big anniversary there, we have chapters in over 60 countries around the world and multiple chapters in different states of each of the different states in the United States of America. Leaders like myself are all mothers. We are mother-to-mother support. We go through a training process that can last anywhere from 9 months to multiple years, depending on how quickly we go through the training. One of the things that I love about being a Leche League leader is I have had wonderful support from Leche League leaders in my breastfeeding journey, which is now going on just over 4 years long. And I like to be able to give back and provide that support to others and help them meet their breastfeeding goals. I certainly met and far surpassed mine. I never thought that I'd still be breastfeeding a 2-year-old, but here I am, and in fact my 4-year-old still asks for it occasionally. I know that's not for everyone, but it works for our family, and that's one of the big things about La Leche League meetings is you may hear things that don't work for your family, and that's okay. As a leader, I represent the philosophies of La Leche League International. However, La Leche League recommends that you take what works for you and leave the rest behind. So whatever works best for you is what you should go by. I am not a medical professional. However, I and many other of the La Leche League leaders, we have 8 of us in Lehigh County and Bethlehem, in Lehigh Valley, Pennsylvania, altogether. Many of us have additional certifications, whether it be nursing or breastfeeding, counseling, international board certified lactation consultant, and other certifications. We're also teachers, and other professionals, and most importantly, we are moms. Again, this is mother-to-mother support. We are all available to answer questions by phone. Many of us answer emails and text messages as well. And I myself, because I'm involved in doing the social media for the Lehigh Valley Breastfeeding Coalition, I also respond to messages that come in through the coalition's various social media channels, including Facebook, Instagram, Twitter, Pinterest, and LinkedIn. We're also on Google+, and now we have our own YouTube channel. So please tune in if you miss any of the meetings or want to find out more information about another breastfeeding support group that's going on locally in Lehigh Valley. Please check out the website www.lehighvalleybreastfeeding.com or lehighvalleybreastfeeding.org. We're at both. And with that, I will start with the common misconceptions of breastfeeding. Many misconceptions exist out there, including when to stop breastfeeding, what signs are there that indicate you should stop breastfeeding, when you might have low supply, what signs there might be of low supply, the best ways to increase your supply if you have low supply, And also misconceptions about breastfeeding while taking medication or having medical procedures done, and even the quote, pump and dump after you've had either medication or alcohol. So I'll be addressing all of those and many others tonight. I'm going to keep this one short since it's just me, unless some other people walk in tonight. So with that, I will get started. Who can breastfeed? Common misconception that you have to have a particular lifestyle or that you have to have a particular size breast, that you have to have done it before, or that you have to take classes in order to breastfeed. Breastfeeding is natural, and it is one of those things that is truly amazing that we can do, and we share that ability with all mammals. That's where the term mammal came from the mammary glands that make up the breast tissue and produce milk. There is no particular lifestyle that you need to follow, although in general we do find that women who choose to breastfeed tend to, even if they weren't following that lifestyle prior to having children, they do tend to lean more towards organic foods and whole foods, and try to lean away from some of the more processed foods. Just it goes along with breastfeeding. But again, there's no rule that says you can't enjoy your double cheeseburger with bacon whenever you want. There's whatever you want to eat. Really, there are no rules against what you can eat when you're breastfeeding, with the exception of allergies. Another common misconception is that babies can develop an allergy to their mother's breast milk. In very rare cases, I mean incredibly rare cases, there is a medical condition that makes it not possible for a baby to consume and properly digest their mother's milk. However, it is very rare. Fewer than 1% of babies born in the U.S. have that condition. And there are actually a couple different conditions. One of them is galactosemia. But there are medications and formulas and other procedures that can be done. So if you are concerned about that, I recommend that you do a search on that. And there's more information about that and other things at healthychildren.org, which is from the American Association of Pediatrics. So I recommend checking out that website if you have an interest in learning more about specific rare disorders. As far as food allergies go, a common food allergy that may affect breastfed babies is an allergy to proteins in cow's milk. Also an allergy to proteins in peanuts or other legumes. Those are certainly not the only allergies, but those are two of the most common allergies that may make breastfeeding a little bit trickier. An allergy to gluten, which is a protein found in wheat, may also make things difficult. But again, those are things that can be easily taken care of by simply altering mom's diet. It does not mean an end to breastfeeding. And again, if you are concerned about food allergies in your baby or food sensitivities in your children, please contact your pediatrician or other medical provider. Leche League does not diagnose allergies or any other medical condition. Again, we are mother-to-mother support. We can share our experiences and the experiences of other moms, but we do not diagnose. That's for the medical professionals. Allergies, again, seasonal allergies. There are many moms who suffer from seasonal allergies, and there is no reason for you to stop breastfeeding simply because of those allergies. Which brings us to medications. Many moms wind up taking medications for seasonal allergies or other conditions. Medications do not necessarily mean that a mom needs to stop breastfeeding. I recommend going to LactMed, which is an app run by the National Institutes of Health. You can also check out the MommyMeds app, which is done by the Infant Risk Center, or you can check out the Infant Risk Center's website at infantrisk.org. They have a huge database of the different medications that may be prescribed and their effect on both lactation, the effect on the baby during lactation, and also there's information on the effect on the baby during pregnancy. So I highly recommend checking those resources out if you're concerned about allergy medication or any other medication that's prescribed. Another common reason that medications may be prescribed to a breastfeeding mom include mastitis. The most commonly prescribed antibiotics, especially for mastitis, include amoxicillin, and amoxicillin is considered by Infant Risk Center and National Institutes of Health and several other well-known medication experts to be generally safe during breastfeeding. And in fact, I know that both of my children have been on amoxicillin themselves. So there should not be concern about, especially during mastitis, which is an infection of the breast tissue. There's no concern about needing to stop breastfeeding simply because mom is on a medication like amoxicillin. Again, check those resources, Infant Risk Center, MommyMeds app, or the LactMed app if you're concerned about a specific medication. Or talk to your medical provider or your pharmacist. And if they're not familiar with those apps and websites, please point them out to them. We are trying to help spread the word. During mastitis, which can happen, as I said, it's an infection of the breast tissue. Mastitis can occur when there are clogged ducts and the milk stays in the mother's breast for long periods of time. Bacteria can get in. Nipples are a two-way system, believe it or not, and I'll get back to that in a moment. But bacteria can get in, and if they stay there, certainly an infection can occur. One of the best ways to one of the most important things to do to treat mastitis or clogged ducts, which is often a precursor to mastitis, is to continue removing milk from the breast. One of the few reasons to put at least a temporary halt to breastfeeding from an infected breast is if there is an open pussy abscess in the breast. But again, talk to your medical professional that is treating you for that to find out the details. In many cases, an infection with mom or with baby does not mean a stop to breastfeeding. Again, bacteria can get into mom's breast through the nipple when baby is feeding. This is not usually harmful. In fact, it is one of the ways that breastfeeding mothers can produce the immune factors, including antibodies, to help fight bacteria and viruses. So some of that, when the baby first latches on, a little bit of the baby's saliva can actually be drawn into the breast, and the breast tissue itself receives the signals to start creating and releasing those immune factors to help baby fight off whatever infection there is. And I say baby generically. As I said, there are young children who are also breastfeeding, and it is more common than you think. It's just often done in quiet and behind closed doors, but it is out there, and people should know about it because it can be a beautiful thing and can help soothe a child that is hurt or upset or sick. I've heard some beautiful stories of children who were about to undergo surgery and hadn't breastfed in over a year, and they were upset, and their mothers nursed them shortly before surgery or shortly after surgery, and they were amazed to find that they were still able to produce milk in those situations. Not much, but they were still able to produce milk in those situations. There are even cases of grandmothers in places where mom needs to return to work and has to live too far away from the baby to nurse effectively, and grandmothers will relactate in order to feed the baby, so mom can keep working and bring in money for the family. Again, that's not necessarily common, but it does happen. So if you are struggling with supply issues and are concerned that this might be the end, or if you stopped and wish you hadn't and hope to relactate, that certainly is something that does happen. And I recommend that you talk to an IBCLC, International Board Certified Lactation Consultant, or other certified lactation professional to get more information on how to do that. Another common misconception is that adoptive parents cannot breastfeed, and I know from friends who have adopted that it is possible to induce lactation without a pregnancy. It is not always the easiest thing to do, but it can be done. And certainly there are stories that I have read of people all over the U.S. and around the world who have breastfed in unusual circumstances. And there are enough of them to make me think that maybe this isn't so unusual. Breastfeeding is one of those things that you're giving of yourself to your children in a way that just can't be done in another way. And that's not the only way to give of yourself to your children, certainly, but the cells in your breast that create the milk are literally giving of themselves. They're sacrificing pieces of themselves to create that milk. And it's just an amazing way to provide for your children. So other common misconceptions that I'd like to address tonight include the idea that breastfeeding has to only happen at the breast. While certainly breastfeeding at the breast is considered the gold standard in breastfeeding, feeding of human milk to human babies through other means, whether it be an SNS system, bottle feeding, cup feeding, through donor milk, or any other form, it can be mixed into homemade baby food. Providing that love and nutrition and, as I said, the immune factors really makes a difference to bonding and can make a big difference in the health of a child. I know that one of my children has special needs, complex medical needs, and breastfeeding was a way for him to get the nutrition he needed when he would not accept anything else. The nutrition of breast milk can change over time and can even change during the course of a day or even a single feeding. The breast milk that comes out in the first few days after birth is known as colostrum, and it is commonly known as liquid gold. That liquid gold is so full of fats and other substances, is so nutrient rich, it has a yellow color. And over time, it's commonly said that a mother's milk will come in. It's that transition from the colostrum, which is the super dense, super concentrated milk that was produced during pregnancy, to the whiter, thinner, more mature milk, as it's sometimes called. So when you hear about people's milk didn't come in right away, it can take anywhere from 3 to 5 days after birth for that milk to come in, because the colostrum is so concentrated, and babies' bellies are so tiny. A newborn's belly is only about the size of a marble. So the quantity needed to sustain a newborn in those first few days until the more mature milk comes in is so small. It's really scary to think of people feeding their newborns 2, 3, 4 ounces of formula or donor milk at a time. So it's, you know, your body most likely will produce, only 5% of women really can't produce enough milk because of glandular insufficiency or other conditions. So it is possible to feed your baby, your newborn, right away and make sure that they get what they need before that more mature milk comes in. Keeping up supply for the first few weeks to even as far as the first 3 months, depending on the mother and the hormones produced by her body, which is different for every pregnancy. The mother may have more milk than she needs for her baby at that time. So often moms who are planning on going back to work will pump. There is no real harm in pumping, although the more milk that is removed from the breast, the more it signals to the breast to make more milk, which brings us to the signs of low supply. A baby feeding more frequently than every 2 to 3 hours may be a baby that is trying to increase mom's milk supply. Maybe a baby that is just nursing for comfort, or maybe a baby that is going through a growth spurt. Certainly that happens. And as we know, babies do not read clocks or calendars, so they may need more attention at certain times of day and less attention at other times of day. Hold on a moment. Mine is calling for me. Hey. Do you want to say hi? Say hello. So some babies need more attention at some times of day versus other times of day. I know with my first, when I returned to work, he often was so eager to see me after the day of being separated from me that he would nurse almost constantly for the next couple hours after I got home from work and we were reunited. And it wasn't so much that he was hungry, he just wanted that connection. There you go. Another common misconception about low supply is that a baby not waking up frequently through the night or not sleeping through the night means that the baby is hungry and mother's milk supply is too low to satisfy the baby. Babies wake up in the middle of the night. Some babies sleep longer than others. Other babies will go just very short times through the night for the first few months. Sleeping through the night is really considered about 5 hours of sleep in those first few months, and anywhere up to 6 months or more. You may not have periods of sleep for more than 4 to 5 hours at a time. That's partially because babies, from an evolutionary standpoint, they are designed to stay close to their mothers, and because a newborn baby hasn't fully integrated all of its sensory systems and reflexes, it is possible for a baby to forget to breathe when it's asleep. And that's not to sound scary or to scare anyone, but that's one of the reasons why babies wake up frequently, is so that they don't fall into that deep sleep for as long, and they are less likely to forget to breathe often enough. One of the things that the Leche League is a promoter of is safe co-sleeping. And there's a book that was recently published, just I think 2 years ago, by La Leche League International called Sweet Sleep. And it is a book entirely about safe sleeping practices that are particularly breastfeeding friendly. I know in the news lately there have been stories of babies who have died because they were sleeping with their parents in a shared bed. But when you read into each of those cases, typically there was drug or alcohol use, maybe prescription drug use by the parents or adults in the situation, or it was on a surface that was not a safe sleeping surface. A couch, a recliner chair, a bed full with soft pillows and lots of heavy covers. So there are other factors that go into it. It's not that all sleeping, babies sleeping with their parents is a bad thing. And I recommend that you check out the Leche League International website, LLL.org, or get a copy of that book, Sweet Sleep, to learn more about the safe sleep habits and the safe sleep rules to keep your babies safe if you do choose to share a sleeping space with them. And co-sleeping doesn't necessarily mean bed sharing. I co-slept with my older one, even though he never really shared the bed with me. He was in either a bassinet or a co-sleeper bed that attached to our bed or was right next to our bed. So he had his own enclosed space. So I couldn't roll over onto him, but he was still arm's reach from me. A pack and play next to the bed or a mattress on the floor next to the bed is another way of co-sleeping without bed sharing. Room sharing is still considered co-sleeping. And again, it's whatever works for your family. Bed sharing is not necessarily the best for every family. I know with my older son, it wasn't the best for us because he moved around in his sleep so much. None of us were getting a good night's sleep, and that doesn't help anyone. My younger one did share the bed with us for the first year of his life. Not all night, not every night, but he frequently spent at least part of the night in bed with us. And it is possible to have different sleeping arrangements for different children. As I shared, my older one did not share the bed with us because it just wasn't a feasible solution for sleep for anyone. And that's something else is there's a common misconception that one child's experience will be duplicated for every child after that. I have heard stories of mothers of twins and triplets where each child had a different feeding personality and sleeping personality because they are different people. So even multiples from the same pregnancy can have different personalities. One would stay at the rest for as long as possible, and the other one was on and off, got what she needed, and was off doing other things as quickly as possible. Which brings me to the common misconception that there is a specific time that each feeding should last. Think about your eating habits. Sometimes you want a quick snack, other times you want a big meal. And that can change throughout the day and can change from day to day. Babies are no different. Sometimes they want a quick snack and may only be on the breast for a few minutes. Other times they want a whole meal and they go have their fill on one breast, go to the second breast, and back to the first breast again. So it really depends on the day, time, and the child, and also the mother's breasts. Low supply, again, is not necessarily signaled by a baby staying on the breast for a certain period of time or getting off quickly. Supply cannot be determined by pumping output. The best way to tell a mother's milk supply is by watching the baby's diapers, wet and soiled diapers, and also by watching the baby's weight gain and their behavior. A baby that ends a nursing session with tightly clenched fists and is fussy right away afterwards may not have eaten its fill yet. Whereas a baby that falls asleep at the breast and has relaxed hands and a relaxed face probably got everything they wanted from that nursing session. Yeah, you. Another common misconception is that taking supplements, drinking Gatorade, or eating special cookies or other baked goods will increase a mother's milk supply. While there's some anecdotal evidence that some of those things may help some moms at certain times, the three most important things for moms to do is rest. A properly rested body can produce more milk. Try not to stress over your supply. The stress hormones that are released can actually inhibit the production and release of milk. And also try to stay hydrated. Again, that doesn't mean that you need to drown yourself with water or drink other specialty drinks. Just normal water or whatever beverage you choose, preferably uncaffeinated, since caffeine can have an effect on reducing supply in larger quantities. Drinking to satisfy your thirst is really what you need to do to keep your supply up. And I said three things, but really the fourth thing is, again, make sure that you're removing milk from the breast as frequently as is practical. The more often you pump, not the longer you pump, there's another misconception, the more frequently you pump, the more it signals to the breast to produce more milk. In a way, supply is driven by demand. And it has to do with the hormones that are released each time there is stimulation of the breast tissue. Prolactin is the hormone that is responsible for making the milk, and oxytocin, the love hormone, is responsible for releasing the milk. And as I mentioned, stress hormones and caffeine can have, and as well as nicotine, can have an effect on the way oxytocin affects the breast tissue and how milk is released from the breasts. So those are some things. It won't totally do away with your supply, but it can affect your supply temporarily. Some other common misconceptions are that alcohol is carried through the mother's breast milk to the baby. The same way it's carried through the bloodstream to the baby before it's born. That is not the case. Yes, alcohol can be transmitted and medications can be transmitted. Proteins from what mother eats can be transmitted through breast milk. However, the quantities in which they are transmitted are relatively small. Certainly in the case of food allergies, you want to be careful, and certain medications. But in most cases, and as is often the case with alcohol, again, with a full-term healthy baby and a mother who is normally consuming small quantities of alcohol or is doing moderate consumption before being pregnant, there is little harm found in having a glass of wine with dinner or one beer or something like that. There is no scientific evidence to back up the claims that drinking a dark beer will increase supply. There's anecdotal stories, but there's no scientific evidence to back that up. But certainly if you are relaxed, and that can help with the release of milk. The amount of alcohol that is transferred through breast milk is so small, research is finding, that a mother would have to be seriously impaired well beyond where it would be safe for her to properly care for the baby before the amount of alcohol would seriously impair or affect the health of a healthy full-term baby. Again, that is given a mom who does not overindulge to begin with, one drink should not have much effect. And really the concern is more, is mother sober enough to properly care for and attend to baby? And so pumping and dumping after drinking is really not necessary in most cases. And those alcohol test strips are not particularly necessary. Sure, if you'd like to use them, that's up to you, but they are not required to test your milk. And again, it's do what you are comfortable with. If you feel that you are not comfortable with breastfeeding your child after you have a glass of wine, or maybe you're going out to a party or a wedding and you plan to have more than just one glass of wine, certainly use your best judgment and do what works best for your family. And I encourage you to do some research yourself. Dr. Jack Newman has some great information on his website, breastfeedinginc.ca. He's a doctor in Canada who is considered one of the leading experts on breastfeeding medicine. And certainly La Leche League is not taking the position of promoting alcohol use and breastfeeding, but it's a common misconception that you need to pump and dump after just one drink. Some other common misconceptions are that particular food items will affect your supply positively or negatively, or will make your baby gassy. Most food items, again, except in the cases of food allergies or food sensitivities, what mother eats is the flavors may be, and certain components may be transmitted through the milk to baby, but they should not make baby gassy. And gassiness is really subjective anyway. Every person gets gassy. Some people are gassier than others, and the only reason that it's concerning in a young child is because babies, the muscles that coordinate the gastrointestinal system from mouth to other end are not always coordinated as well, and it can be difficult for babies to burp effectively, especially young babies, or to pass gas effectively. And they may be uncomfortable, but there's really no harm in it. A gassy baby simply is a gassy baby, and may be uncomfortable, but is not in any danger, as long as they can release that gas eventually. One of the other common misconceptions is that spicy foods should not be eaten by breastfeeding mothers, and I can tell you firsthand that it is totally possible to eat foods as spicy as you like without causing your baby much discomfort. And in fact, you may find that later on they have developed a taste for whatever spicy foods you enjoy. My 4-year-old, I remember he was 2, and kept asking for more curry because I enjoy curry, and didn't let that stop me from enjoying it when I was breastfeeding. And certainly there are people around the world who breastfeed their babies and consume spicy foods on a regular basis with no ill effects to their children. Some of the common misconceptions about supplements to increase supply, fenugreek is often one that people suggest, or nutritional yeast, brewer's yeast. While certainly there is some anecdotal evidence that different moms experience an effect on their breast milk. Some of those do have some side effects. Fenugreek is known to make babies gassier. Again, not a bad thing medically, but can make baby uncomfortable, can also make mom uncomfortable if she's gassier because of fenugreek. But there's no scientific evidence that really supports using fenugreek or brewer's yeast, nutritional yeast, or many of the other supplements to increase mom's supply. There isn't much harm in it, but there's no scientific evidence to back up their effectiveness. One supplement that I have seen some studies on, scientific studies on, that does show promise is moringa or malunggay, which is sometimes sold under the brand name of Golacta. There are some scientific studies that do indicate that there may be some positive effects in mother's consumption of moringa leaf, which can be found in capsules or powders, and increase in milk supply. Again, I recommend before you take any supplements that you research those supplements and find out whether they're really effective and whether they're really safe. There are certainly lots of supplements out there that are not considered safe, but are marketed to people for all sorts of remedies of different conditions. Another common misconception is that a mom needs to stop breastfeeding her child at a particular age. Reasons cited are once baby has teeth, the baby doesn't need breast milk anymore. Once the baby is eating solid foods, the baby doesn't need breast milk anymore. Once the baby is 6 months old or a year old, the baby doesn't need breast milk anymore because the nutritional value isn't there. And to all of those myths, there's really no evidence to back up those myths. Certainly, children who have teeth enjoy breast milk, and it continues to benefit them because of the nutritional value, the comfort, the immune factors that are included in breast milk, the bonding. And breastfeeding isn't just about the benefits to baby. There are also health benefits to mothers who are breastfeeding. Breastfeeding is associated with lower rates of ovarian cancers, breast cancers, lower cholesterol, lower stress levels, lower blood pressure, lower incidences of heart disease and obesity, and also diabetes. There are many health benefits to both mother and child from breastfeeding, and again, I recommend that you do some research on that to learn more about those benefits, and some of that information can be found at La Leche League International's website, LLL.org, and also some of it can be found at LehighValleyBreastfeeding.org. Another great resource is Kelly Mom. That website is done by Kelly Banyata, who's an IBCLC, and has lots of great information on breastfeeding, breast milk, the benefits of breastfeeding, and also common misconceptions and solving common problems of breastfeeding. As I said at the beginning, breastfeeding is natural, but that doesn't always mean that it's easy. With my first, I had cracked and bleeding nipples after the first couple weeks of breastfeeding. That's most often caused by a poor latch. Another common misconception is that breastfeeding should hurt or does hurt. It shouldn't hurt. There may be some initial discomfort, but if you're having toe curling pain or are dreading latching your baby onto the breast, there's a problem that needs to be addressed. It shouldn't be that painful. There are common misconceptions about toughening up your nipples first or putting all sorts of things on your nipples to prepare them for breastfeeding. And in many cases, that's just not needed. And even many of the ointments that are used and creams that are used afterwards, you want to remember that if it's on your nipple when your baby goes to feed at the breast, they will be ingesting it. So please be careful with what you put on your nipples, and make sure that if it's not something that your baby should be ingesting, that you wipe it off thoroughly before feeding your baby at the breast. Or before pumping. That doesn't mean that you can't use things like antibiotic ointments, and in fact that can be important for helping cracked or bleeding nipples heal, but make sure that what you are using is either safe for ingestion by your baby or is thoroughly cleaned off before you feed or pump from your breast. Another common misconception is that once a baby has teeth, you need to stop because the baby will just bite. There are tricks and tips for how to stop a baby from biting at the breast, and some of them include just watching the baby's suck pattern and having a pinky finger ready to sneak in and break that latch when they start to bite down. Another trick is and here's my sock monkey baby, to when a baby bites, to press their head in just for a moment. It will temporarily cut off their air supply. Don't worry, you're not suffocating your baby. As soon as the baby realizes that they can't get the air in, they will open their mouth to get air in, and you can safely remove them from your breast. Again, you're not suffocating your baby. It's a momentary press into the breast. One of the last things you want to do is have a baby that is clamped on either with teeth or just before they get teeth, those hard gums, pull them off, because that can do damage to the nipple, and it's also very painful. As I said, at the beginning, I am still nursing a 2-year-old who has somewhere between 16 and 20 teeth. And he does occasionally give me a little bite, but he has learned at this point that no, he cannot bite. That hurts mommy, and that means no milk. And as I said, I also have a 4-year-old who occasionally nurses, and he certainly has 20 teeth. And again, he has learned over time that he should not bite because that means no milk. And we started that process of teaching him when he was just a few months old, and before he really even got his first teeth in. Once a baby is eating solid foods, or begins eating solid foods around 6 months or thereafter, there's still a need for the breast milk, because right away a baby does not eat food effectively enough, or efficiently enough to have all of their calorie needs met. And there's still the hydration needs that are met through breast milk. Breast milk is over 80% water, which brings me to another common misconception, that babies in hot weather or dry climates need to have additional water. As long as the baby is feeding at the breast as much as they desire, there is no need for additional water. And additional water in a young baby, earlier than about a year old, can actually be dangerous to the child, because it can offset their electrolyte balance, and can actually cause water poisoning in extreme cases. So I feel like I've been talking a lot about misconceptions. There's so many out there. I could keep going for hours, but there are some great resources out there that give you more information about common misconceptions, including La Leche League International's website, LLLI.org, Kelly Mom website at kellymom.com, Jack Newman's website, breastfeedinginc.ca, and there are other websites out there as well. I recommend that before you do your research, or as you're doing your online research, remember the internet is open access. Anyone can post anything they want. Please make sure that you're getting your information from a reputable source for information. Healthychildren.org is done by the American Association of Pediatrics. The the Academy of Breastfeeding Medicine has a website. Infant Risk Center has their website. Certainly CDC, Centers for Disease Control, womenshealth.gov is a good resource for information and can get you links to other good resources for information. Always check out, whenever you're doing online research, particularly on health topics, always check out who is writing the site and where they're getting their information from. What are their credentials? How do they get their expertise? And if you're not sure where someone who's helping you has their expertise or has their experience from, ask. CLCs are certified lactation counselors, and they go through a training process. Leche League Leaders, Breastfeeding USA counselors, all go through training processes. International board certified lactation consultants have a training and certification process. And there are monitoring boards for all of those, and you can write to the credentialing agencies and check to find out whether someone really has the training that they claim to have. And there are certainly other organizations out there around the world. But I recommend that you do your research, find out what works best for you and your family, and don't just believe everything you read on the internet or hear from the mom on the street or the grandma on the street. Or even, I hate to say it, but even some doctors just aren't up to date on the current research. So if something seems not quite right to you, check up on it. It is possible that someone's working with old information. Again, you're always welcome to contact us, the Leche League Leaders of Lehigh County or of the Bethlehem chapter. There are 8 of us. You can find our contact information at lehighvalleybreastfeeding.org. You can also go to LLL of easternpa.org, and I apologize if this is backwards for anyone. And you can also check out some of those other resources I referenced earlier, Leche League International's website, Jack Newman's website, or kellymom.com, and certainly Infant Risk Center. I hope everyone has a good night and is enjoying, at least in Lehigh Valley, the coming of cooler fall weather. I've gone on for much longer than I thought I would, but have a good night, and please check out those websites, and don't forget to ask questions. If you're in pain or having trouble breastfeeding or know someone who is, encourage them to go get help. There are many reasons why breastfeeding can be difficult, but there are just as many people out there willing to help and trained to help. In hospitals, in doctors' offices, and moms groups, online, and all around you. So please, if you need help, get help. And have a good night.